Has your child been diagnosed with ADHD and you're wondering what the next step is and how to manage this? Well, that's what we're going to talk about on today's video. Hi, I'm Dr. Obidi, pediatrician at Partners in Pediatrics and Adult Care. And today we're going to handle part 2 of our ADHD series, addressing how to manage ADHD. Now, there are a couple of things I want to mention here. One is that it is normal to feel overwhelmed when your child has been diagnosed with ADHD and you're wondering how to manage it. But remember that this is a treatable condition. And remember that your child can be supported to fulfill their full potential. And this doesn't always have to involve medication. However, medication can play an important role in making this happen. Also remember that each child is different. And so the treatment for each child may look different. This really has to be tailored to the child's condition, their circumstances, where they're having the most difficulty, to arrive at a very personalized plan when it comes to treating your child. This is also a partnership. So it's really important that you're in very close communication with your child's pediatrician or medical provider to make sure that you're both on the same page and that you're giving appropriate feedback so they know how those medications or strategies or treatments are working and if any tweaks need to be made as regards to meeting your child's treatment goals. You do need to establish a treatment goal. What are we trying to accomplish? Are you trying to get your child to be able to pay more attention in school, but maybe home is not such an issue? Or maybe you're really trying to make sure that they can settle down and get homework done, maybe helping with chores, helping with cleaning up their rooms. This can really look different for each child and each family. And so it's really important that early on you establish what the treatment goals are. So when you meet them, you know you've made some progress. So we are going to cover a couple of different things when it comes to treating and managing your child's ADHD. One is going to be parent training and behavior therapy. We're going to talk about medications, lifestyle changes that can be helpful, school supports, and how the school can partner with you. And then there's going to be a word about complementary medicine or alternative medicine when it comes to managing ADHD. Let's talk about parent training first. This isn't like going to parenting school. However, when you have a child who has ADHD, it can be very helpful as a parent to acquire a few skills if you're already lacking when it comes to these skills. Remember, ADHD tends to run in families, so it's very likely that a child who has ADHD has one or two parents who also have ADHD. So they may also have their own challenges that they are walking through when it comes to being able to pay attention, attend to tasks, and have routines. Parent training will look like learning how to set very clear expectations with consequences, learning how to have consistent routines that your child can thrive with, and learning positive reinforcement techniques such as praising your child when they do something good, rewarding them with maybe stickers when they're following through with instructions that you've given them. Now, behavior therapy for your child will include things like teaching them how to have impulse control, helping them learn how to be more organized, and helping them learn how to regulate their emotions when they feel overwhelmed in any given situation. Now let's talk about schools and how the school can partner with you in helping your child manage their ADHD. There are two ways your child's school can help. One is establishing a 504 plan. Now, this is where the school is able to make accommodations for your child depending on their individual needs. And it could include things like providing preferential seating, so they're able to sit away from distractions in the classroom depending on how the classroom is organized. It includes maybe giving them more time to get work done. It could include maybe headphones that they can wear to reduce distractions. It could also involve movement breaks, so they have breaks during the course of their day so they can get up, stretch their legs, move around, burn some of that energy, and get back to settling down to get their work done. So again, this is very individualized. I will tell you just from experience that sometimes some teachers are very good at this even without a formal 504 plan. However, it is important and I think useful to have a formal 504 plan so that this is documented in your child's record and so it's consistently implemented across your child's educational experience in school. Now, the other plan your child can have is the IEP, or Individualized Education Plan. And this is where support is provided and tailored to your child's individual needs. It might be pulling them out of class for specialized one-on-one tutoring or teaching. It might mean pulling them out of their larger class to a smaller class for particular subjects. Again, this is going to be very individualized, but it's important that if your child can benefit from either a 504 plan or an IEP, that you explore both of those routes. Next, let's talk about medications. And this is where a lot of parents can get very overwhelmed when they think about medicating their child for ADHD, because sometimes it can have a very negative connotation. However, I want to remind you that ADHD is a real condition and it is a medical condition that you can manage. The goal really should be to help your child achieve their maximum potential. Now, when a child has migraines, we don't really frown at giving them medication to help manage their migraines, or if they have asthma, we usually do not frown when it comes to giving them an inhaler to help them breathe a little better. And so we should carry the same mindset when it comes to treating children who have ADHD. We want to provide the support they need, because there was a study that showed years ago that when children who grow into adults are not treated for ADHD, that if they still have significant symptoms as adults, we're more likely to get into trouble with the law, more likely to have problems holding down a job, and more likely to have issues with relationships. And so it's really important for us to treat ADHD where it needs to be treated. And yes, there are some children and adults who have ADHD and have developed coping skills that you're able to utilize, and so not necessarily need to rely on medication for control of impulses or attention or hyperactivity. But where it is needed, my encouragement is to go ahead and provide that treatment. So when it comes to medication, there are two big classes of medication. Those are the stimulant medications and the non-stimulant medications. They both have side effects to watch for. They can both be equally effective in the right patient. And so this is a conversation to have with your pediatrician to decide what particular medication may be helpful in your child. Now, in my experience, it can often be difficult to predict what medication may work in a particular child. And so I always talk to parents and say, let's go into this with an open mind, realizing that it may take a few tries to get to the right medication for your child. And I know that can be tasking sometimes on the heart, because you feel like, oh my God, am I using my child as a guinea pig and just experimenting on what medication might work for them? But our chemistries are different. So sometimes it's difficult to know what medication will work best for each individual child. So just have some patience with the process. Make sure that you're communicating very clearly and often with your medical provider so they can guide you in this process and help choose the right medication. The key to remember here is that when it comes to medication, we are going to start low and go slow, which means if it's a medication based on weight, or if it's a medication that's just based on response and your child's age, again, we will start at the very lowest doses and titrate that dose up as needed, keeping in close communication with you so that if there are side effects that are showing up, that we know of them and we can communicate clearly with you and come to some shared decision making as to how to handle those side effects. Some side effects are mild and kind of pass with time, like maybe some mild abdominal pain or mild headaches. And some of the ones may be more significant, like mood changes that may require us to change medication. Sometimes it's a matter of just decreasing the dose. Other times it's a matter of supporting your child. Say, for instance, your child is on a stimulant medication that is affecting their appetite. You may just need to augment their calories, making sure that each meal you're providing more calories so that even though they're eating smaller quantities, the overall calories may stay the same or increase. Now, what about complementary alternative medicine? Now, some parents may prefer to go the more natural route when it comes to treating your child's ADHD symptoms. There are substances that have shown some effect in some children However, oftentimes these are not as pronounced as with the other medications, such as the stimulant medications like methylphenidate or amphetamines, or non-stimulants like clonidine or guanfacine. Now, these other substances, I'll mention three of them: omega-3 polyunsaturated fatty acids, saffron, and the third, Bacopa monnieri. Now, these have had some studies that have shown mild to modest effects when it comes to controlling either attention or hyperactivity or mood, and being able to better control impulses. And so these can play a role in controlling some ADHD symptoms. But like I said, they are oftentimes not as effective as the other medications we mentioned earlier on. Now, where parents will want to use some of these substances first, it does require you to be patient, because you may have to treat for up to 3 months to see some of these effects, and you'll have to determine if these effects are enough to control these symptoms or if they still need better symptom control. Now, let's talk about other very supportive treatments that are helpful in every child, which is going to be things like focusing on your child's nutrition. Are they eating good, clean calories? You want to clean up your child's diet as much as possible, where they're not eating a lot of highly processed foods and very high sugar containing foods, because these oftentimes do not support a child optimally when they're already having hyperactivity, inattention, and concentration issues. The other good thing to talk about here will be sleep. It's really important that your child is getting good sleep, because that supports good memory recall and executive functioning when they're awake. So really aiming for as much as 9 to 10 hours of sleep, 10 hours ideally, but I know sometimes that can be difficult to attain in some of our children. So at least if you can get 9 hours in there, that will be great. Making sure they're well hydrated, having more structured schedules at home, and the big thing, really controlling screen time. Especially before bedtime. Your children really should be off the screens at least an hour before bedtime, because this really helps them to be able to calm their minds down and settle down to have better and more satisfying sleep. So there you have it. I hope this has been very helpful when it comes to treating your child's ADHD. Again, remember that the goal is to help your child to be able to really attain their full potential. Remember that this is a very individualized process. You really need to be in close communication with your child's pediatrician or medical provider so that you can come up with a plan that best suits your child. And remember, you're not a bad parent for wanting to treat your child's ADHD. If anything, it means that you are really being supportive and that you are taking this seriously, knowing that this can really impact their functioning and their potential as they grow from little kids into young adults and being able to be good functioning members of society. So if you're a parent who has a child who has been diagnosed with ADHD and you're wondering, how to treat and what to do, or maybe you're still, wondering if they even have ADHD, we'll be more than happy to sit with you if there's a concern about ADHD. If you haven't seen my previous video where I talk about the symptoms of ADHD and how to diagnose it, you should go watch that video. This is Dr. Obidi at Partners in Pediatrics and Adult Care. If you're in the Washington County area in Maryland, we would love to be able to care for you. Love this video. If it was very helpful, go ahead and give it a thumbs up and share this with a parent. You have children that they're either concerned have ADHD or already have ADHD. Go ahead and send this to them. That will mean a lot to us. And thank you for watching this video, and I'll see you in the next one.